We'll go ahead and kick it off, and Alan, the minute I sit down, you may start, brother.
Thank you, David. Wow, this is a big group here today. First of all, thank you for coming. And because I had the short straw, obviously, to be the first person, I'd like to thank the EDC for this effort because healthcare is important. When you look at healthcare as a part of our society, it's huge and it's changing. And what we need to understand is we spend a lot of money, over 17 grand per capita, much more than any other industrialized country, and the results don't speak for themselves. We don't get what we pay for. So our challenge here is to figure out how to provide the quality of care in Okaloosa County that we feel we need and we deserve. I view my job as trying to coordinate to some degree the effective and efficient care in our community so we do not have to go to Pensacola or Panama City. With all respect to Pensacola and Panama City, I think we ought to be able to figure out how to have quality care here where we live. And that's what my job has been now for some 13, 14 years at White Wilson. What I'd like to talk about, and before the gong master removes me, okay, is two things. One is White Wilson, briefly, and number two is some perspectives I have, and I'd like to share. By show of hands, how many in this room have had care provided at White Wilson? Just by a raise of hand. Oh my God, thank you very much. We appreciate the confidence that you have in us. You know, simply stated, White Wilson is a outpatient medical services organization. We know it mostly by the fact that we have some 75 plus providers, and we have huge imaging services and a lot of lab services, and we operate an Emerald Coast Surgery Center. So we try to provide care, a wide range of care that's linked together by a common electronic medical record. And we're happy to say that we've made great strides, and we're in the top 10% of groups across the country that have achieved the level of technical performance in that arena. In fact, most recently, what we were able to do is coordinate with Fort Walton Beach Medical Center. And if you're an inpatient at Fort Walton Beach Medical Center now, and you're a physician, if he's a White Wilson physician, orders a test, those results go right into your electronic medical record at White Wilson that day. It's phenomenal now because now your medical provider can look at your record in a very time-sensitive fashion. He doesn't or she doesn't have to wait a week or so to get the results back. We're making progress in that regard. A couple things I want to share with you also about White Wilson. Number one is our vision is the community to be the community's choice, and we've been doing it for some time. We literally have been doing it since 1946, and we recently celebrated our 70th anniversary. And so we're proud of that, and we're proud of the confidence everybody has in us. In the interim, what we've done is we've been able to be the largest provider of health care just in Okaloosa County. And that's important because the industry is consolidating. And what we have more often than not is health systems with a combination of multiple hospitals or hospitals and medical groups providing the care. White Wilson today, at least, is an independent organization. In fact, we're like a small business. Even though we have 450 employees, we're locally owned, locally operated because we want to keep, again, care here. So that's a little bit about White Wilson. What I'd like to talk briefly about is the future. And I think in the future, what we need to talk about is, number one, access to care. We need to make sure that we have care available in cost efficiently and in a timely manner. The other thing we need to do is collaborate. What we have to do today more than ever before is health organizations need to figure out ways to work closer together. For example, under the leadership at Fort Walton Beach Medical Center now and ourselves, we were able to work together to put in a world-class intensivist program. I've had numerous physicians in their area, non-White Wilson physicians, come to me and say, the intensivists at Fort Walton Beach Medical Center are the best I've ever seen, or the best I've seen since I've been in training. Our third intensivist we're getting is coming right from the Cleveland Clinic, to give you an idea. We're very proud of the fact that we're improving substantially our capability. Now, I have been, as an aside, I have been trying to talk as fast as I can. The gong master here is now waving me 2 minutes, okay? And I want to get into the meat of the stuff. And that is, where do we see the future coming? And we need to talk about the stakeholders. We need to talk about the payers. We need to talk about the physicians and the providers in the hospitals. But we really need to talk about the patient as a customer, because there's a huge shift now from the physician being the center of the universe to the patient as the client, as the customer being the center. And we need to better understand how we as patients, we as customers, can make a difference. Now I'm catching my breath before he says my time is up, okay? What we see also here is a number of trends in the industry. And what we see is, for example, from a patient perspective, you're paying more than ever before. You're more engaged than ever before in your decision making. You're going to use telemedicine more than you ever thought about doing. And what we have to do is figure out how to take those new technologies and how to make an informed decision as to how we spend our healthcare dollar, so we are sure that we have the most efficient system. And then what we want to do again is to go back and say, what are the things that we can do to keep healthcare here? And with that thought, I respectfully bid adieu before the hook comes out and replaces me. Thank you.
Thank you, Alan. Well done. When Alan first came, he called me and asked if we could do a strategic plan for White Wilson. We did it, and he has, and I've done a lot of strategic plans for a lot of businesses, and they usually just sit on a shelf. He actually took it, implemented it, and has even gone beyond it. So congratulations, well done. Okay, so next we will have Ronnie Daves from North Okaloosa Medical Center.
Thank you. Again, like Alan said, thank you for having us. We're happy to be here. I think you can already see that we have a collaborative group in this county. We do work well. We talk a lot. Even though we are competitors, I think we are trying to do the best that we can do with what we have and then share what we don't. I work well with Mitch on things that he offers that we don't up at North Okaloosa Medical Center. I am kind of the redheaded stepchild. We're on the other side of the Air Force Base. So again, a lot of you guys raised your hand for White Wilson, which is down here. I'm sure some of our county comes down here and gets care, but we are up there providing good care, working on better care. I am the new guy. Dan made jokes that you guys can't hold me accountable. I got here in August, but corporately, yeah, I was accountable the day before I got here. So it's a great facility, a little 110-bed facility. We pretty much offer everything, working on offering a lot more. We've added a lot of orthopedists looking for urology and things like that, so we continue to grow. But as Alan said, cost, collaboration, things like that are things that are coming. Healthcare is the most highly regulated industry other than the nuclear industry. And we also have very high government payers. So again, we're very reliable on the government, the elected officials, especially at the presidential level. The things that will change in healthcare over the next few years can be daunting, and we can never bet on them. So as we try to collaborate, provide the quality care that we need, we've just got to work better together. So again, North Okaloosa is on a high reliable pathway. We are working to try to be better at taking care of people. The nuclear industry and the airlines are very highly reliable, and we both have basically the same gravity. When we make mistakes, they are catastrophic. They lose lives. They disable people when we make mistakes. So one of the biggest cultural changes that I'm working on at North Oak is trying to make a non-punitive approach to when we have errors, when we get close to errors, and when we find errors. You guys as industries as well, when you make mistakes, people get in trouble. People can lose their jobs, processes change, and things like that. Healthcare is very tough. Lean and Six Sigma in healthcare has become a big push, but it's really, really hard. Pneumonia in me is much different than pneumonia in Nathan. He may not drink his 8 glasses of water. He may not exercise. He may exercise more than me. So again, as we try to improve those processes and policies and pathways to make people better, it's different every single time. Greg has a little bit more management. He knows exactly what's in that metal. So when he tries to manipulate that, it'll do what he thinks it will. We have so many moving parts within the human body that it's really hard to dial those processes in and drive those errors down to that 99% spot. But as we work towards that, we have to be self-reporting. We really have to say, this error didn't make it, but we were really close to having an error with a medication or with a process or with a procedure. Nobody wants to have knee surgery on the wrong knee. That's not a good plan. Not a good plan. So again, when we get close to those things, it's kind of like the Swiss cheese model. When all those holes line up, we've got problems, but we need to catch each and every one of those holes. So one of our biggest approaches right now is working on that, trying to make sure that our culture of reporting things that haven't quite gone right doesn't really get you in trouble. Now, if it happens a lot, it's still going to get you in trouble, but we're all human. Met a lot of physicians who think they're God, but they're not. We're all human, and we make mistakes. So we do need to work on that, and so that's kind of one of our biggest approaches. I kind of have a history of building better relationships with physicians. White Wilson's not much in my market, so other than independent physicians, I usually employ them. So I'm working on building those relationships, keeping our physicians engaged, making sure that we find good physicians to come to the north side of the county. It's a little bit harder than these guys that are closer to the beach, but we're close enough that I can use that a little bit. So we have lots of dinners down here. But again, super excited to be part of this organization. Super excited to be here. Coming from South Carolina. South Carolina is a little bit more of a struggling state than Florida. The unemployment rate's a little bit higher. An economic development council would never be this big in the areas that I have been working in the past. So it's super exciting to see all you guys show up to these quarterly breakfasts and the meetings. And just happy to be a part of it and work with these guys down here on the south side of the county. So thank you very much.
And now we'll have Roger Hall. Now, Roger is not just president of Sacred Heart Emerald Coast. He's the former board chair here. He was chair of the EDC many years back. So, Roger, come and tell us about Sacred Heart.
And one quick thing, I am cleaning up his mess. He was at North Oak probably 10 or 15 years ago.
Thank you, yes. I've made lots of messes. But I have a twin brother, so I blame him all on him. But it's a great morning. Glad to see all you here to support the EDC. Healthcare's changing. You know, we're not only outside the county. You know, it's nice to come to Okaloosa County. My family moved here in '56, so this place wasn't here then. But healthcare's changed. When we think about Sacred Heart, we're really part of the Daughters of Charity. We're part of a mission. You know, there's always the controversy in healthcare, the for-profit, not-for-profit. I'm the only not-for-profit. See the comment I get? Because we do make money. But we started with the Daughters of Charity over 400 years ago. Then the Daughters of Charity moved to Pensacola in 1916. You know, when you think about when healthcare started with the daughters in the Panhandle, there's no Medicare, there's no Medicaid, no Blue Cross. You know, they work with the community, and the community started off a hospital and donated the money. And then we look at years later that journey ended up in Destin. And the thing that really always makes a difference when we started our hospital, we were blessed by Bishop Ricard, and he came in and he said, you know, this is a holy place. It's different, and we always feel that we're impacted by our mission, and I think it's important for when we think about healthcare, and certainly we all have our missions, but our mission for Ascension Healthcare, we're largest not-for-profit, largest faith-based healthcare system in the United States. And this is our mission. Rooted in the loving ministry of Jesus' healer, we commit ourselves to all persons, especially those that are poor and vulnerable. Our Catholic health ministry is dedicated to spiritually centered holistic care and sustains and improves the health of individuals and communities. We are advocates of compassionate and just society through our actions and words. So, we look at healthcare in a very holistic standpoint, and I think all healthcare providers do that. And if you look at what that mission is taking us in our hospital and in the Emerald Coast, is that we're in operation 14 years, and 12 of those, out of 12 of the statistical years, we've been a top 100 hospital 5 times. Becker's Review ranked our hospital as one of the top 100 community hospitals last year. We've won numerous PRC awards. We as other hospitals here, it's a great community. When Dave talks about healthcare, 3 of our hospitals were graded A by Leapfrog as patient safety. So I think all of our hospitals recognize that. North Okaloosa was a B. Ronnie's changing that. So we have high quality health care, and our journey in Destin is that we're now in our 7th major building project in 14 years. We've started out, we expanded our ER, we added our Oceans Diagnostic Center, we've added the family birthplace, we've added, expanded our cardiac service, and today we have a $30 million project to expand our patient beds, expand our emergency department, and to expand the family birthplace. And we're definitely part of the community. When we started our hospital, we went to our community and we asked them to help us make a difference, and they contributed $10 million to our hospital. Today we've raised $34.5 million to be able to make healthcare different in our community. And if you think about our expansion when we're making this additions, the real difference that we're really focusing on now is kind of what Alan was talking about, the working together. Is anyone had trouble getting an appointment with a physician? We see those issues. Has anyone had trouble with scheduling and being able to navigate the healthcare system? Have you faced tragedy? And you think about the bad outcomes. So we put in a system of navigation from our emergency department that we're able to take patients from our emergency department and get them a medical home. And we measure that success on keeping them out of the hospital. And we're successful 62% of the time on navigating patients from the emergency department. These are people with no insurance, no ability to pay, and we're measured in our community not how we take care of the people with the best insurance, but how do we take care of the poorest. And so we're proud of that navigation. We also have in our family birthplace educators for our moms that are expecting, and we take them from the expected delivery to after delivery. We have now navigators for our cancer program that's connected with MD Anderson to be able to go through the terrific efforts that you have to make on coordinating that care from one stage to another. And I'm getting Alan's hook. Alan, you took my time. But we see that access isn't only providers, but it's the communication. Alan talked about being able to communicate with the hospital, and that's important. But we need that all through the system, and certainly we need to work together. So the hook is there. Thank you. God bless.
Yeah. Winston Churchill said, ask me to speak for 3 hours, and that's easy. Ask me to speak for 6 minutes, and that's hard. And it is. It truly is. So I appreciate what these gentlemen are doing. Next, we have Dave Whalen. I'll tell you, if you walk into an organization, you can always tell if it's well led. And you walk into Twin Cities Hospital in Niceville and you can tell it is well led. And the leader of that organization is with us this morning, Dave Whalen. Dave?
I always hate following Roger. Roger doesn't know, we're friends, I think, and we've helped each other many, many times professionally. Now, Roger does not know it, but I was raised Catholic. And then I found out that if the Methodists, it's okay if you go fishing every other Sunday, so I switched on over. Now, Ronnie talked about competition, and yeah, we have to compete. We all have to run our businesses. But I want to go back a little bit to healthcare here and how it's developed. In 1987, when I got here, that's how long I've been at Twin Cities, you had Twin Cities, which was affiliated with West Florida in Pensacola. You had Fort Walton Beach was Humana, and there was a Destin Humana hospital that was not particularly functional. Sacred Heart didn't exist. Roger was raised here, but he wasn't in the county at that time. He came much later. And if you looked at it compared to today, we're pitiful. Humana was more interested in insurance and morphed into an insurance company, abandoned their hospital wall totally. HCA went through merger mania, divestiture mania. The 90s were damn nearly insane in the corporate structure. If you look at the flag, I couldn't know what flag to put up out front. It kept changing every other week. Now we have an environment where Roger's running a good show, North Okaloosa's running a good show. There's nobody here that's not. If you had a heart attack in 1987 and you were at Rocky Bayou Golf Course or Blue Water Bay, you might get loaded by EMS and into my ER or whichever ER. It'd probably take 30, 45 minutes. By the time you got to the cath lab in Pensacola, 2 to 3 hours minimum would have gone by. Your survival chances are going down about every 30 minutes. You can click off about 10%. If they got you over there and you needed open heart surgery, if we could wake up Dr. Wolverton, you might go through that process. So where are you today? You have 3 hospitals that do caths. We do not. If you drop out there today, one of the 3 of them you're going to get into pretty quick. Okaloosa Cardiology or whoever is going to get in there. They're going to angioplasty you. They're going to stent you. If that's not adequate, then you'll get to see Sandwith for open heart, and he's pretty quick. Your survival chances in this county are probably up a couple of 100% over that 30-year window. If you want to live somewhere, that's kind of important. Particularly, I know I look younger than Roger, but I'm really not. Dan's his older brother. Don't let them fool you. They use that Grecian stuff. I just let mine fall out. So when you look at what's happened in this healthcare today, in this county, the changes, you see the building in Destin, the Emerald Grand, all the tourist stuff. Healthcare has quietly advanced in unbelievable ways. Fort Walton is now a tertiary care center in my eyes. Fort Walton is now in the process of becoming a trauma center. Let me tell you why that's important. 12 years ago, I had a son out here on 98 who had stupidly talked me into buying him a Jeep. And he dumped it. And I mean, he endoed that thing, he landed in front of ongoing traffic. The helicopter at Rogers Hospital happened to be overhead and saw it. And dropped down immediately. EMS got there well after the helicopter. And they flew that boy to Pensacola to Sacred Heart's Trauma Center. If that had not happened, that boy would be dead. I've seen a lot of dead guys in the military. I know what a cadaver looks like. And when I walked up to his gurney, my heart stopped. I was sure he was dead. The difference today, with all of this wonderful development we've had, if the weather is in and the helicopter can't fly, you're not getting to Pensacola in the golden hour for trauma. So if your family member, your child, your spouse is out here in 98 in the summer and has a horrible wreck, if we can't do trauma locally, you are probably going to lose that family member. That's the next link that we need, all of us need, as a community, as healthcare providers. Yeah, we compete, but not at the expense of our people. That's why I'm supporting that trauma center 100%. And I hope you do. Probably blew my 6 minutes, didn't I?
I've worked with Dave a long time out in Niceville through the Niceville Chamber, and he's just so reticent. I can't get him to say what he really thinks. You know? But I'm working on it. Okay, now I'd like to introduce Roger Hall's older brother, Daniel Cobbs.
Thank you. I appreciate being here and with this distinguished panel. One of the things I wanted to cover, we sponsored the event, but I would like to just go over a couple of things that are on the table. One of the most important things that I think could make a difference in the workplace is this little card, so don't underestimate it. It's how to recognize workplace violence. Of course, we do that training through our employee assistance program, but if you can just keep this in your wallet or somewhere, that some days it may really help somebody. And actually the person that actually does that is Larry McFarland, who's here today, that provides that training. And if you want to know what employee assistance program is, that's what we do through Soundside Wellness Consultants, and that's what this little brochure is. So I'm going to take a little bit different tack. I appreciate Sheriff Ashley being here. He's my bodyguard usually where I go since I work in the psychiatric business. And actually we do have a lot of things in common with public safety. But today's mostly about Soundside Wellness Consultants and what we do. And it's very similar to what you do in your organizations. So how can that be? Well, let me ask you a few questions, or better yet, you can just ask these questions to yourself. Do you spend some time at work trying to figure out why an individual's behaviors is negative or why they do what they do? Do you get frustrated sometimes that change is going too slow or maybe not going at all? Do you have a problem with a particular person or group of people and you need a remedy to stop their toxic behaviors? Do you need to work on some type of work plan to attain better performance or peak performance? Now, those are some of the things that we all do in our organizations. And at Soundside Wellness Consultants, that's what we do as individually with people, but more on a private, personal, confidential dialogue. And that dialogue is handled by licensed therapists and medical staff that consist of MDs and advanced registered nurse practitioners. We're a private practice, which means it's commercial insurance clinic, and we're bound by confidentiality. And we work on behavior that changes motivation for better feelings of wellness. That's the simplest way I can say it, just putting it in a layman's terms. The thing that we use in most, and even at Bridgeway Center, we believe in evidence-based practice standards. Because when you're in a hospital, you can get a gallbladder x-ray, and if it's opaque, that's bad. So you can very easily see through some type of film whether you have a good organ or a bad organ. But in our business, it's a little bit different. So nationally, they've proven through research studies these have the best outcomes, and that's what we use. So let me give you a couple examples. You may have heard of cognitive behavioral therapy. That's pretty basic, but you're working through different thought patterns and getting people to change the way they process. We use motivational strength-based interviewing, and we use trauma-focused therapy. The last one is dialectical behavioral therapy. Kind of a fancy word, kind of mask it, and what it really means is that we're working with people that are borderline personality disorders. You've heard that term before, but it's people who have extreme mood changes, very unstable. You can recognize that generally because they're inconsistent from one week to the next, which is why it's so problematic. If you talk to a therapist, they're going to put a cross up because that's the worst, most difficult type of patient to handle. And also they self-harm and they have suicidal ideation. So those are the different types of groups in the therapy that we use and the best practices, even at our private practice clinic. And we use the same physicians and ARMPs and licensed therapists at both Soundside as well as at Bridgeway Center, mostly out of economical terms, but at the same time, we wanted to make sure there was no wrong door. So that's kind of our philosophy, that there's no wrong door. We see people at Bridgeway Center, if they have no coverage plan, and if you do have a coverage plan, then it's at Soundside Wellness Consultants. So exactly what happens if you do go in for therapy? Well, really, one of the most important things is help you identify your personal coping skills that each of you have. The other thing is to help you recognize that there are good stressors and bad stressors. And most people don't realize that. You do want stressors in your life, but you want to make them more favorable versus negative. And at the same time, we help people with their thought patterns. And when I say thought patterns, it's what the first thing you think of when you wake up in the morning or the first thing you think of when you're going to bed at night. Things that give you anxiety or things that make you feel better. So what we're trying to do at that time is to make it more of a goal-setting process so that people can feel more safe about what they're doing or happier or a greater sense of wellness. So I guess back to when I said before, we're like you in many organizations. How are we the same? How is Soundside Wellness Consultants the same as you or your organization? Well, first of all, we're optimizing, or we're attempting to engage in customer dialogue to have a better relationship. So it's all about relationships. And number two, we measure our success by outcomes, by results. That's why we get measured whether we're successful or not. And that's the same way at Bridgeway Center. And I think that you've heard before, the state did go through a lot of turmoil, but one of the good things now that I can actually say is that there is measured outcomes in all the services we provide. It got to be very bureaucratic and highly regulated, probably more so than what you needed, but now it's finally whittling down to where it's really acceptable, and we can prove that we're providing the best outcomes. And the last thing that we do, the same thing that you do, is try to build brand customer loyalty. That's really what it's about. So that people can, through word of mouth, know that they actually are better off when they now that they came in and when they leave for the first time. So the other relationship that I want to kind of mention in organizations, you say, well, how is a psychological or a psychiatric organization really related to your organizations? And one of the things I would say is, well, the very first thing is in your organization, you have to have a compelling direction or a vision of some sort. And that's what we try to give our patients or our clients, a vision of where they want to be and help them succeed. The second thing is that you need to have a strong structure that people can take some chances, and it's okay to fail on small steps. And I'm sure that you do on a management level, that you make it acceptable to have some failures, otherwise there's no risk, and in business there's always some risk. You just have to try to keep it at a small level. But we do that with our patients as well, to build their self-confidence and to build their resiliency so they can come back from maybe falling down or making a mistake. Because that's how you actually build resiliency, is through dealing with adversity and being confident enough to work through it. The third thing that I think that we really stress is collaboration. So that's where there's a cross-referral between Soundside Wellness Consultants and Bridgeway. When I said it's the same integrated medical staff, what's really helped is electronic health record, which all of us have now, and it's fantastic for us. And as a matter of fact, just on the judicial basis, one of the things that we do is we provide services for the court, for dependency court, and now in dependency court, different caregivers, and which is really not the best because it's my gender that usually messes up. The male gender is always fabricating things, but with electronic health records, you can tell actually when people are doing things or not doing things properly. So that's the end of my presentation. I just want to let you know that we do appreciate the support of being here and providing the therapeutic services.
I had the privilege some years ago of serving for 3 years on the board of directors of Fort Walton Beach Medical Center, and I remember the plans we had and what we intended to do. And I can tell you that since Mitch has been there, he's doing a great job of carrying out those plans and exceeding them. Mitch Mongell, CEO of Fort Walton Beach Medical Center. Mitch?
Good morning. Today is day 1,840. I tend to count up as I work in places. It makes everyone nervous, but I truly enjoy being here. I've been in healthcare for a long time. I work with the Franciscan Sisters at St. Mary's for over 10 years, Cleveland Clinic, and I've been with HCA for over 20. My last 5 years before coming here, three and a half years ago, was in South Carolina, rural South Carolina, like Ronnie. And I'll tell you, we don't really understand how great it is here compared to some of those rural counties. My job when I came was to change image, to change the culture, to look at where Fort Walton is going. And I was successful with different hospitals of changing that. This is what I like to do. Our community is very vast. And when you look at what we have here compared to sending out, that was my job to change. And when you're in a small community, whether it be Fort Walton or Destin, you always think bigger is better, like many of these gentlemen have said. We rarely transfer out now, which is fantastic. We have recruited. Why go out when we can bring in? So with our cardiovascular surgeon from Mayo Clinic, our trauma surgeons, Houston Clinic, who's just a great partner with trauma. They train the Ted Macy's of the world, and Jimmy Andrews, a very talented group. We have been able to bring talent to our community, so we don't need to transfer out any longer. But I wanted to give you some statistics about our hospital. We've had some great successes, and I'm very proud to share these. Our Joint Commission this year, we were the best in company. We had a phenomenal report. Consumer Reports rates us as the 4th best on volume based on infection prevention. Leapfrog A Hospital, like we talked about, we continue to be there. We're a top performer in the past consecutive 4 years. We have Stroke Award from the American Heart Association. We're Stroke and Joint certified. Commission on Cancer accreditation. Our labs are accredited through what's called CAP. We are accredited through the CARF accreditation for our rehab units. All of our imaging is ACR accredited. We have won several awards, and we're very proud of what we've achieved. But more importantly, looking at what we have done for our community, if it wasn't, I look around, I see so many faces that made us successful. We wouldn't have been as successful, whether it's with our sheriff, our mayor, our board of trustees, our physicians, and many of our physicians go back and forth. We have been just so thankful to partner with the school district and others. We have a lot to go. We have a big agenda ahead of us. We've added a big capital campaign to include our ED trauma expansion, which will take about 18 months. Our psych holding area, which is under construction, it'll be finished in August. A freestanding emergency department in Destin, which will be done by the end of the year. 2 new cardiac cath labs. First floor renovation has just been approved. We have the newest Hologic 3D mammography, which is state of the art. And we look at continued expansion within our obstetrics and pediatrics. But Alan talked about our intensivist service, which is 24/7. They're either on call or they're in-house 12 hours, or we have our trauma intensivists, which are board certified. So we're very proud of how we can care for someone around the clock. But we talk about our community, and this is from our 2015 impact. This is Dave and my hospital together. Our payroll is in excess of $85 million. Our cost of charity and uncompensated care is over $17 million, closer to 18. We have over 14,000 admissions, over 81,000 emergency department visits. Our Medicaid and our indigent patients account for $18.5 million. We take care of, we talk about, we are a proprietary hospital. We do pay taxes, and we take care of our patients locally. Almost 69.3% of the indigent care is treated in our hospitals. So we do our fair share. Our capital investment has been $7,200,000. We'll probably add about $35 million to that within the next year. Our local vendor support is over $16 million, with minority and women-owned businesses at $1.7 million. Our physician specialty coverage is almost $10 million, and our total economic impact is over $158 million. So we're very proud of what we have been able to accomplish locally. As we add, since I've been here, we've been adding over 60 employees a year. With trauma, we added 62. There are statistics that for every employee that you have, 1 in 2 are added to our community, up to 1 to 7. So when you look at that average, you can look around 270 additional employees locally, whether it be through restaurants or cleaners. We're very proud of what the impact of all of our hospitals do for our community. Healthcare is very important, and we will continue to drive it. But more than anything, thank you so much for our community, for what you have done for us and having the faith in us. So thank you very much.
We will now begin the question and answer session. There are people in the audience. If you have a question, just raise your hand and we'll bring a microphone to you. The way we do this, if you want to direct it at a specific individual, say that. And if you don't, we'll open it up to all of them. Just go down the line, and those who wish to comment on the question can do so. And if I need to prod you, I've got a whole list of questions that have already been asked. Sheriff, we'll start with you.
I want to thank Walton Beach Medical Center for making the economic appeal for this community to bring a trauma center here. Having had 4 officers killed in the line of duty, I don't know that any of them could have been saved had the trauma center been here. But the care that you have provided for them and the families, we need a trauma center. And thank you for doing that. I know you've also invested a great deal of money in our psychiatric unit and the security at a hospital. Is security necessary at our hospitals? I would ask each of you, do we have those in our emergency rooms and the like? We had 1,649 Baker Acts in Okaloosa County last year, 997 in Santa Rosa County, which a lot of them came to this hospital, and 333 in Walton County. That's a lot of mentally challenged individuals. Are we overusing the Baker Act, the Myers Act? And if we are, what's the alternative if we don't? Do we put them in our jails? Is that where they're treated? I mean, that's a multi-pronged question, but I just want to say thank you for the investment in our community for each of you. And how do we deal with the mentally challenged, the mentally ill? Because they are a threat to our community.
We'll start with Mitch and then just come this way. And any of you who would like to comment on that, just feel free. And if you don't, you can just pass. Mitch, go ahead.
Thank you, Sheriff. Your job's getting tougher every day. I can see, from our own ER, the patients that are coming. But are we overutilizing? I believe we are. But we need to provide a safe environment for many. And many times they're Baker acted for their own safety, and once they, whether it be sober up or come down of what they're on, that we can discharge them safely. There are many that are mentally ill that need to be Baker acted. And I think the law enforcement does a good job. We receive them from 3 different counties that's the reason for our expansion, our continued expansion. But the job is getting tougher. It's frightening because at hospitals, we are not a prison. We can't restrain them. We do whatever we can to have a safe environment for them. But alternate solution is to look at some of those, especially during spring break, to wake up somewhere else other than a hospital where we have TV and it's warm and we feed everyone. But once we know that they're safe, if we could have a healthcare worker, a nurse, a psychiatric team in our jails to try to offload all that that's coming to our hospitals, all of ours.
Specifically, I can relate to this because I know that when we were actually running the inpatient for psychiatric services, we averaged anywhere from 300 to 350 patients or people walking in claiming that they needed services. I think the force multiplier in this, which is what I'm referring to as, is that one of the things that we hope to start in probably late July is a mobile crisis support team for children. It's a 24/7 nights, weekends, and holidays, and it's based upon you don't have to have any coverage plan to get the service. So anybody can receive the service, whether it's a military personnel, any child can receive that service. So that's one of the ways that we think that we're going to be contributing to help Fort Walton Beach Medical Center as far as reducing the number of children that need to be hospitalized, because there is no CSU and never has been for children in Okaloosa County. So that's the first step. The second step is then go back to the legislature and ask for adult services as well, that we think that we can actually decrease the number of psychiatric admissions by using the service. And that means that we actually would go with law enforcement to when the first crisis occurs in the home, no matter what time of day, or in the school. I don't know if Mary Beth is here or not, but that's our plan, and I hope to talk to the school resource officers. It's just, right now, we just got the dollars, we just got the approval, we haven't hired anybody yet, but our goal is to hire experienced people and start with children first and then work our way with adults. It won't completely help Fort Leach Medical Center, but it's a step in the right direction, and we can stop a lot of the, as Mitch knows, a lot of people that go to ERs wait to the last minute, and many don't have insurance coverage. So this is one of the nice things about this, and I have to give credit to Senator Gates, who helped me steer the way through the legislature and compete with 67 other counties. Right now, it's been around for 5 years. They studied it, and they finally now opened it up to, there's 23 teams that are providing the services out of 67 counties, and we're one of them. So I'm really pleased to do that. So hopefully a year from now, you'll see the big results in that, and it's a step in the right direction. So that's what I can give you hope for.
Good, thank you, Dan. Dave, would you like?
You know, we don't do inpatient psych at Twin Cities, but if you look at mental health, there's a couple of things wrong with us. First of all, as a people, if somebody has a mental health problem, it's kind of a dirty word, and people look at it in a negative way. From my seat, there's no difference between somebody with a mental health issue and somebody with an acute med-surg issue. Hot appendix, mental health, no difference. It's a medical thing. We need to treat it. Depression's a good case in point. There's lots of folks in this room who've suffered periods of depression. If you take the medicine, it's under control. If you don't, bad things happen. That gets mixed up with substance abuse that the sheriff and the law enforcement people and EMS deal with all the time, and it's a big convoluted thing. But people do not want to treat mental health as a medical problem. They want to put it in a dark closet and put it away and pretend it's not there, and that don't work. The second piece of it is funding. Most insurance companies have very limited funding. The federal government walked away from their funding years ago. They took the position of and the state did as well. We're going to mainstream these people. We closed most of the institutions. You have people walking around on Hollywood Avenue by Eglin more often than not when I drive over there. Those people don't look like they can take care of themselves. So the first thing with mental health is an adjustment in attitude in all of us. Is it real or is it not? It's very, very real, folks.
One of the things that Mitch just reminded me is that we're 49th out of the total United States as far as funding for mental health. So even though we live in paradise, dysfunctional people come here because it is paradise. So it's not like you can just ignore it. And that's probably one of the problems because of the fact that what we're doing right now, just to let you know, and this is just basically triaging as much as we can. We can't fix the whole problem because we need funding, but at least it's a step in the right direction. And that's really the cause because it's been like that for over 25 years. So luckily, the legislators are beginning to realize that we can prevent hospital admissions, we can prevent law enforcement officer events, we can prevent courts being tied up, and probably prevent jail expanding with inmates that don't really need to be there due to misdemeanors of mental health, or potentially stop them from committing felonies.
Anybody else like to comment? Okay. I say I've been remiss up here in terms of introductions. These are our private sector health providers, and that was the plan. But a huge part of health in any community is public health, and we have the director of public health for this morning. Karen, stand up and take a bow. Okay, next question. Wayne, you had a question.
Thank you all for being here today, and I appreciate the information. I'm curious, last week was at a forum where they talked about PAs as well as telemedicine. Can you expound a little bit on the future for us in this area, on the more use of ARNPs, advanced, come on, help me, Daniel.
Advanced registered
nurse practitioners, thank you.
We'll start down at this end.
Okay, thank you very much.
Just so we define our terms, what I'm understanding, Wayne, is that we don't have enough physicians, so there seems to be more and more movement to bring in mid-level, such as a PA or ARNP. Is that correct?
Correct. Also, with the advancements in ACA, affordable health care, that it's caused some cost changes with respect to the use of doctors, and some of the doctors leaving us because of the billings that they don't get or they have in the past.
Well, this is a subject we could talk a long time about, but just some basic info on it. we are medically underserved in primary care in this market. And so that means, based upon our demographics, we don't have enough primary care physicians to serve our needs, particularly internal medicine. So what we need to do is find mid-levels like ARNPs or PAs to help solve that issue, that shortage. What studies have shown is that with respect, for example, in family practice, the average family practice PA or ARNP can do between 85 and 88% of the task that a family practice doctor can do. And that is at half the cost. And let me go back again to make sure we understand that. In an area of a zero-sum game where we're trying to be more efficient and you have a shortage in one capability, it's natural for many entities to look at alternatives. And so across the country, what you're going to see is more mid-level professionals, allied health professionals, taking the place of primary care. It is unfortunately, in some view, a fact of life. You do that for availability, accessibility, and cost. So that's step one. I think step two is, as we look around to try to solve the problem long term, I think the conventional view is that we will not have, medical schools cannot graduate enough primary care physicians in the short term to solve this. However, you can have new schools come and develop, and you have new programs that we see a lot of PAs and ARNPs that are designed to fill the gap. What I believe is going to happen is we as a society will change our perception, because the role of the primary care doc is changing. Under what is going to be called population management, you're not going to have an individual physician like you had before. You'll have a care team. The care team is chaired by clinically a physician, but you may have an ARNP, you may have a PA, you may have a technician to support the effort. For example, if you would go to your internal medicine physician and you had diabetes, what you'll find is more and more a mid-level is going to help coordinate and provide care under the general supervision of the internal medicine physician, but you may only see the internist once every 2 or 3 visits. It is changing in that regard, and that's what I believe that's how most communities are addressing the short-term needs.
Mitch, did you want to see anybody else want to comment?
And I think it
hang
depends.
on. The question was, how do the doctors feel about the PAs and so forth?
Well, I think it depends on the circumstance and the individual doc. I think in many cases, the physicians in general are supportive of PAs and ARNPs because they meet a patient need, and most physicians are trying to meet those patient needs. What's confusing is going to be new ARNP programs, for example, give a doctorate, and they can practice individually. So the society is going to be confused in the short term because there may be Dr. Mary Smith, ARNP, okay, not an MD, but a PhD equivalent, and that may be confusing to some. But I think generally it's viewed as a positive sign because physicians really want to care for their patients.
I think we had, Kay, did you have one in the back?
Yes, sir.
Gentlemen, let me first say thank you for the high quality of health care that y'all are obviously providing to our area, and we're the beneficiaries. Thank you so much for that. My question is for Fort Walton Beach Medical Center. Sir, could you expound upon the condition or the current position of the trauma center, what's currently being provided, and what we can expect in the foreseeable future? Thank you.
We started roughly a year ago. We've had over 400 activations. Since last night, we've had 6. This morning, we had a gunshot wound to the head, which our trauma center needed to be at, and many, many falls. People are on blood thinners. For everyone, stay off ladders. That's very important. But what's happened is we went through our first meeting with the American College of Surgeons. We're going through a different path. We're the first hospital in Florida to ever go through this path, where we go through the American College first, and then we ask the state to recognize us. The legislative body afforded us that trauma center, but we have not been designated, and we do not charge for that trauma activation fee. So what's happened is we expect in November to have our final accreditation. We went through with flying colors on our first meeting, and we will continue to expand that service line to the point that this new emergency department will have a helicopter landing area up on top of the roof so we can free up Marwalt Drive, because we're becoming a little bit more busy on Marwalt than we ever have been.
Mayor, did you have a question?
Right,
Yes,
yes,
sir.
sir. Thank you. I just am curious as to, you talk about getting the capabilities here. And I've had some experience where we had to be referred to Pensacola and then they couldn't do it. Then we had to go to Alabama, Birmingham to get it done there. But the crux of the matter is the exchange of information between the centers and the referring doctor. There seems to be a reluctance for some reason to get the information from Birmingham to Pensacola to hear the referring person. Is there really a problem in that? Is it an ethical? I don't understand why I need to then go back to Alabama, Birmingham for a 1-hour office visit to see how things are going and then come back home.
Would anybody like to comment on that? Roger?
I think that's a huge issue. One, we really need a universal patient record to be able to interface. We talked about the White Wilson's communication back with Fort Walton, but we have those issues like even with Ascension, that we're one large network, that we're working on the capability right now to be able to transfer that information. When we look at all these computer systems, the real issue that we have is they really don't interface with one to another, so it becomes difficult to have one electronic medical record that doesn't really communicate to the other. Now we really need to look at how we really communicate and how we're able to do. And piled on top of that is the personal information in HIPAA that we have to guard that. So it's a problem. I think we're all aware that there's not a direct solution, but that's why we need to communicate and work together to solve those issues.
Thank you, Roger.
I'm pressing the button. There it is. Why these systems can't work, why if you fell out in San Diego, why I can't get your record to scripts like that. That was not from the, and initially there was supposed to be 5 vendors in the United States, and they were all supposed to interact. Well, they don't, and there's scores of them now. I've got a son-in-law who has a master's in software design, and one day I was asking him, why do these things not work? And for me, and put it in the words that a dummy like me can understand. If I wanted to send something to Scripps or they wanted to send something to me, we each have firewalls. In fact, we have a series of firewalls to stop things like this new ransomware that's running around the country. I could send your record to Scripps right now, and they could send it to me if we were both willing to drop our firewalls. Nobody's ever going to drop their firewall in today's world. So until we find a way to safeguard transmission of data from bugs, ransomware, and all the other vices that are out there, I don't know that we'll ever see an answer to your question. Because you have to protect what you have, or there's bazillions of bad guys, a lot of them offshore. They bring you to your knees in about a nanosecond. That's the biggest problem.
Okay, well done. We have time for one more question, and she's ready right in the back.
Two-part question, just very quickly, and I'm a newer resident to the area, and I happen to sit on a few boards of tech companies, and one of them happens to be electronic health records, and I was thrilled to hear Alan right at the start of the gate in the 6 panelists bring it up. I'm wondering, the first one is, are any of you using My Health Vault on the cloud to go around what Mitch just described? Or do you have another way that the patient can leave with his or her records? It's one thing we all have in common. We're all patients here. and sometimes we're waiting on the records to catch up to where we are in the medical process. The second one is completely unrelated, but goes back to Mitch and Dave's comment where they're talking about the trauma center. And I'm wondering, and maybe I'm missing something as a newer resident and it's been in the media, is it a capital campaign issue that you're waiting on or a certificate of need issue in the legislative process? What is the challenge in order, because I was frankly shocked at how far away the local trauma is. Thank you.
No, it's a verification process. The state of Florida only recognizes those trauma centers which can go through a temporary certificate. We do not have that. The legislative body appointed us. It's not a capital issue at all. It's going through an accreditation, which is the highest level of accreditation is the American College of Surgeons. We're just doing that first. It can sometimes take up to 4 to 5 years. We've done that in 9 months. So we work very quickly. We expect to have a fully functioning trauma center. We are not verified yet, but we will be. We are accepting all the trauma patients that arrive at our facility. And your first question is, we do have a portal that our patients are able to sign into, their own portal, and look at their healthcare results.